Good afternoon, it's Friday, September 25. I'm Herman Green with the Midday News. If you're watching on onespotmedia.com, again, a special welcome to you. Thanks for joining us. Entertainer Vybz Kartel and his co-accused have been granted conditional leave to take the case to the Privy Council. Leave was granted this morning by the appeal court. Attorney Bert Samuels, who was speaking with TVJ's Prince Moore via telephone a short while ago, says the defense is happy with the decision.
The team of Sean Campbell and Adija Palmer and the others are very elated because we have been granted conditional leave to appeal to the decision of the Court of Appeal to the Privy Council. We've been happy that there are some jury grounds which have gone and some admission of evidence grounds which have been permitted to go to the Privy Council. The Court of Appeal has seen it necessary that those grounds need to be resolved by another court. So it's a very good day for us, and we're looking forward to victory in the Privy Council.
How soon do you expect the matter to go to the Privy Council?
Well, we have a month within which we must prepare the papers and have them onto the bundles and send them onto the Privy Council. We're looking for, if it is expedited, a Christmas decision.
The government has been spending big in the fight against the COVID-19 pandemic. At a COVID press conference yesterday, Permanent Secretary in the Ministry of Health and Wellness, DUNSTAN BRYAN, outlined the expenditures thus far.
The Ministry of Health and Wellness is reporting that it has spent $4 billion in the fight against the COVID-19 pandemic. Speaking at a media briefing on Thursday, Permanent Secretary in the Ministry, DUNSTAN BRYAN, said the money was spent between April and September. Mr. BRYAN said 40% of the $4 billion was spent in June and July to fulfill commitments made in March and April.
Our commitments to equipment, our commitment to PPEs, our commitment to drugs, our commitment to the build-out of infrastructure. And those commitments came in June and July, and we were able to pay those bills to the tune of $4 billion.
He says that the majority of the funds were spent on drugs and personal protective equipment for health professionals. This, he says, cost approximately $1 billion.
The next high expenditure item is the amounts that we spent on accommodation, and that is primarily based on the return, the citizens with the controlled re-entry program that we undertook in April, May, June.
The ministry has spent approximately $728 million on the 4 regional health authorities. Mr. BRYAN says the funds were geared towards facilitating contact tracing, financing activities at the health centers and hospitals, employing 121 doctors who were out of a job, and providing salaries for community health aides. The ministry now has a balance of $1.5 billion of the $5.9 billion it was allocated.
Of that $1.5 billion, approximately $370 million are commitments that are to come in for payment. The balance, Minister, though, is based on other expenditure that we will have. So tomorrow you will sign contracts that...
Prince Moore, TVJ News.
The government is this afternoon declaring that it has not turned a blind eye to the daily increases in the COVID numbers. Concern had arisen that the government is not given the attention needed to deal with COVID-19 since community transmission started on September 4. But Health Minister Dr. Christopher TUFTON at a press briefing yesterday said not so. The details report.
Health Minister Dr. Christopher TUFTON is assuring the country that the government remains on top of managing the COVID-19 pandemic. His declaration comes amid heightened dissatisfaction with the level of response from the government since community transmission of COVID-19 began. He says a strategic approach is what is currently being used by the government in its response.
We are, as a government, as a people, and certainly as a Ministry of Health, continuing to take COVID-19 and the response to COVID-19 as a very important and an absolute priority for the health and wellness of the population. The numbers are concerning, and every positive case is a concern. Every death is a tragedy. And so we each day deliberate over how to improve the process and the response.
Dr. TUFTON noted that the Health Ministry's early models had projected that up to 1.5 billion Jamaicans could contract COVID-19. He said the numbers so far are way below projection.
The reality is that based on that modeling, we put in place a plan to mitigate against that level of impact. And to date, if you look at the numbers of positives, hospitalization, and the unfortunate cases of death, the truth is we're doing much better than the modeling suggested. And that is because of the work that we have put in.
In the meantime, National Epidemiologist Dr. Karen Webster-Carr says there are early signs that the number of new cases of COVID-19 is beginning to stabilize. This means cases could soon begin trending downwards. Dr. Webster-Carr says this is despite the fact that it's taking fewer days to reach 1,000 new cases.
It took us 151 days to reach the first 1,000 case, then 20, then 8, then 9, then 6. But there is some stabilization, and hopefully it means that if we continue or we improve our actions as a society, then we could see the flattening of the curve, and hopefully we would have peaked and start going down from that peak.
O'Shane Masters, TVJ News.
Meanwhile, Dr. TUFTON is denying claims that the government has abandoned contact tracing amid community spread of COVID-19. Opposition spokesman on health, Dr. Maurice Guy, made the claim yesterday, saying the absence of contact tracing heightens the risk of exposure to the respiratory illness. However, Dr. TUFTON says the claims are not true.
Contrary to reports in the news media up to earlier today, that contact tracing has been ceased. We no longer do contact tracing. We are still engaged in contact tracing, and that therefore is a wrong impression to give. That is why we had announced long ago the engagement of additional staff in the field in the form of community health aides. And we have gotten permission and have budgeted for up to 1,200 such personnel. And as said last week, we have between 700 and 800 already deployed.
He said the employment of 121 medical officers to the clinical team is also part of the efforts to boost contact tracing and equipping health facilities to deal with more cases. Dr. TUFTON says the ministry is currently following more than 3,600 contacts of persons who have tested positive for COVID-19. Meanwhile, there have been an additional 3 deaths linked to COVID-19. The latest deaths are an 84-year-old female of a St. Catherine address, a 46-year-old female of a St. Elizabeth address, and a 68-year-old male of a Clarendon address. This pushes the number of COVID-19 deaths to 80. Meanwhile, the ministry says 2 deaths are under investigation. In the last 24 hours, there were 135 new positive cases of the virus in Jamaica, bringing the total number of confirmed cases to 5,723. 4,063 are active cases. 119 persons are in hospital, with 7 critically ill and 44 being moderately ill. And we now take a break here on the Midday News, but stay with us. More news when we return. Welcome back, continuing the news. Questions are being raised about the lack of enforcement of the plastic ban, which was implemented in January last year. Chairperson of the Jamaica Environment Trust, JET, Diana Macaulay, says there are still reports about plastics being sold on the local market. She believes enough is not being done to minimize the use of plastics.
From the very beginning of the plastic ban and then later the styrofoam ban, there have been, if you go on social media any day of the week, there are people reporting where they're still being sold. And there just has never seemed to be an adequate response to that. So Whether it is a question of lack of will, lack of resources, lack of personnel, I don't work at NEPA, so I don't really know. But I will say in my time, I have seen resources expended on enforcement. So personnel are deployed to a scene, reports are written, legal advice is taken, and yet still enforcement is not carried out. So I would lean on the side of lack of will.
She maintains that the fines are too low to serve as a deterrent.
So NEPA's fines are low, and that too is another matter that has been, talked about and said that the fines are inadequate for at least 15 years. But there was a significant fine brought in under the Trade Act because the plastic bags were mostly imported. And so the idea was if you could stop them coming in, then that would be the state at which the enforcement took place. But I stand to be corrected, but I don't recall seeing a case using the Trade Act. I do recall cases that NEPA has brought. But the fines are small and therefore they're not an adequate deterrent.
A member of the Jamaica Defense Force, JDF, was shot and killed in Clarendon last night. The soldier, 21-year-old Private Renel King, was shot and critically wounded in an operation in Milk River. It was reported that Mr. King was attacked by gunmen about 7 o'clock during an operation in Baker Beach, Milk River. Private King was shot in the head. TVJ News understands that the private was airlifted to the Maypen Hospital. He was later transferred to the University Hospital of the West Indies in Kingston, where he died while undergoing surgery. Over 2,000 pounds of ganja was discovered during the operation at Baker Beach. And Mayor of Kingston and St. Andrew, Mayor of Kingston, DELROY Williams, says plans are being made to have legendary artist Frederick Toots Hibbert laid to rest at the Cultural Icons section of National Heroes Park.
Toots is a pioneer of the music, and that is without question. He's known internationally, but was very instrumental at the beginning stage of our music and very instrumental in putting our music on the global stage. And the municipality, we believe that it would be quite in order to have him buried at the National Heroes Park. Also, that would also be in keeping with the municipality's developing of a design and plan for that space that is designated for a cultural icon. We intend to design what we refer to loosely now as a legend park.
Toots died on September 11 at the University Hospital of the West Indies. Hibbert was hospitalized late August after he developed breathing problems. He was said to be awaiting a COVID-19 test result. Toots is credited with popularizing reggae music and even naming the genre. His 1968 single, Do the Reggae, is the first song to use the term. We're going on to news in sports. Football's world governing body, FIFA, on Thursday suspended the Trinidad and Tobago Football Association, TTFA, with immediate effect due to what the governing body has described as grave violations of the FIFA statutes. Here's Spencer Darlington with details.
In the press release, FIFA said the suspension was prompted by the former leadership of the TTFA lodging a claim before a local court in Trinidad and Tobago in order to contest the decision of the FIFA Council to appoint a normalization committee for the TTFA. FIFA said that course of action was in direct breach of Article 59 of the FIFA statutes, which expressly prohibits recourse to ordinary courts unless specifically provided for in the FIFA regulations. A normalization committee was installed by the FIFA Council after it was established that the former leadership of the TTFA had engaged in various acts of serious mismanagement. FIFA claims that the decision of the former leadership to go to a local court to contest the appointment of the Normalization Committee jeopardizes not only the future of football in Trinidad and Tobago, but also endangers the overall global football governance structure, which relies on the Court of Arbitration for Sport (CAS) as the exclusive forum for resolving disputes of this nature. The relevant parties were initially given until September 16 to withdraw the case but failed to do so. FIFA says this deadline was then extended until September 23, which was not respected either. In the circumstances, the Bureau of the FIFA Council has decided to suspend the TTFA. FIFA says the suspension will only be lifted when the TTFA fully complies with its obligations as a member of FIFA, including recognizing the legitimacy of the appointed Normalization Committee and bringing its own statutes into line with the FIFA statutes. Spencer Darlington, TVJ Sports.
And that's the midday news. Remember, the primetime package is at 7. Please join us then. On behalf of the news, sports, and production teams, good afternoon.